Good afternoon, everyone. I hope you are doing well and staying healthy during the pandemic. Thank you for joining us in today's webinar on lessons learned from non-governmental actors on the implementation of inclusive and adaptive disaster response in Southeast Asia. This is the first series webinar under the initiative of Southeast Asia Resilience Knowledge Hub and brought to you by RDI in collaboration with ASB and CDP. My name is Suryani Amin. I'm an RDI research fellow and I'm going to moderating today's webinar. Let me begin with a rationale on why should be inclusive in disaster response. Southeast Asia is one of the most disaster affected region. Number of people affected is expected to rise, worsened by the impact of climate change, which increase number and frequency of hazard. Different populations may expose to similar hazard, but their vulnerability is depending on their physical and socioeconomic condition. Some group of people may disproportionately affected as they are more vulnerable. Those are including people with disabilities, women, elderly, minority group, those living in poverty. We experience situations where most vulnerable groups in societies are at greatest risk suffering from impact of disaster. Hyogo Framework for Action on Disaster Risk Reduction highlights a need to a particular focus on the most vulnerable areas and groups in disaster responses. The disaster risk management is supposed to aim to address vulnerability factors to reduce risk and therefore needs to consider the full range of vulnerability drivers. It will be interesting to listen to our presenters' experience on how the inclusive disaster response implemented on the ground. This webinar will be focused to NGO perspective, but we expect to exchange also ideas from audience, here including public sectors, academics, and other government and non-government stakeholders. With me here, I have three guests. Let me introduce you to our presenters. Our first presenter is Pak Mercy Rampengan. Welcome, Pak Mercy Rampengan. I'm proud to introduce him as one of RDA Senior Research Fellow. He will deliver a talk on CDRM and inclusiveness in Indonesia, taking lessons from community-based disaster preparedness in Bandung. Pak Mercy is a lecturer at Manado State University. He holds a PhD majoring Earth and Environmental Sciences from James Cook University. Pak Mercy wrote quite a number of journal articles and research publications, those including Mobility and Livelihoods, a Small Island Perspective, Social and Cultural Aspect and Engaging Communities in Managing Multiple Hazards, Reflections from Small Island in North Sulawesi, and Participatory Mapping for Disaster Risk Reduction in Community. Vulnerability of small island community to disaster, factors impacting resilience in Eastern Indonesia. Our next presenter is Lauren B. De la Cruz. She's going to share us her experience on CBDRM in the current context, some lessons learned from the Philippines. Lauren is a development specialist with more than 30 years of professional experience in development work. She has specialized in disaster risk reduction and management, climate change, human rights, peace building, and psychosocial development work. She serves as the lead convener of the Disaster Risk Reduction Network. She is also currently the regional representative for Southeast and East Asia for the Global Network of Civil Society Organizations for Disaster Reduction, where she sits as the global board member. Our third panelist, let me welcome Ibu Krisan Lili Kusumawardoyo, a Master of Arts in Development Studies with major in Women, Gender, and Development from Institute of Social Studies, Erasmus University, Rotterdam. She has significant experience in managing regional programs and grant partnership. Her strategic focus includes inclusive disaster risk reduction and humanitarian response and wider social inclusion. She is leading the DIDRRN consortium in implementing a joint Asia-Pacific program on ensuring active participation of persons with disabilities in disaster risk reduction policy and practices. Aside from managing regional partnerships, she is also responsible in several consultancy projects, including leading the research grant funded by ELRA's Humanitarian Innovation Fund on Inclusion in Humanitarian Action as the principal investigator. Ibu Lili is working with ASB. It's a German relief and social welfare organization engaged in a wide range of social service provision in Germany and abroad. ASB started working in Indonesia in 2006 following the Yogyakarta earthquake, and in the Philippines in 2014 following Typhoon Haiyan. ASB Indonesia and the Philippines is committed to improving meaningful access and participation for all. Bu Lili will run us through her early findings from investing in inclusive WAS. We will later have 20-minute slot for each of presenters, and we'll later open a discussion session afterward. If at any point you have questions, please drop us a message in YouTube chat box, or you will find a link to Padlet. It's a platform you can use to filling in with your questions. Don't forget to put your name and organization along with your question, and if possible, to write whom the question is directed to. Before we go any further with presentation, I would like to invite Jiten Kumar from RDI, who will walk us quickly through some RDI research related to disaster and climate resilience you might find useful. RDI is an Indonesian think tank initiative that focuses on environmental changes and sustainable development. Jiten is RDI program manager. Pass over to you, Jiten.
Thank you. Thank you, Buyani. And I hope my voice is coming through clearly. Thank you, Buyani, for the lovely introduction to our speakers today. And I would like to thank the speakers today also for generously providing their time in order to be able to present their materials today. So my presentation will be brief. I will just be providing a short explanation of what RDI is, what our experiences are, and probably just a brief run through of our current projects, just to give you a picture of what RDI is and how we are involved in developing knowledge in terms of resilience issues, according to our position as a think tank. So so this is an introduction to RDI. Next, please. Okay, so RDI stands for Resilience Development Initiative. We are a think tank, global think tank. We are based in Bandung, in Indonesia, and our primary focus and foundation is contributing to the body of knowledge of sustainable development and resilience studies. Next. Now, our mission, as I said before, is to contribute to the body of knowledge and sustainable development and resilience research. But also, we aim to be a leading institute in research and sustainable development and resilience studies in Indonesia and Southeast Asia. Okay, next, please. So, as perhaps you may know with your own experiences, the field of sustainable development and resilience is actually quite wide. And we try to encompass every important aspect into our research clusters, which we have then divided into 7 research clusters. Renewable energy and emission reduction, we call it REAR, disaster and climate resilience, the DCR cluster, the children's social welfare and health, regional and urban policy, finance and business management, tourism and cultural heritage, and lastly, water and waste management. So today's webinar actually is part of the activity that we conduct as part of the disaster and climate resilience cluster. More on that after this. So we also have a network of research fellows, as you might see, of which Buyani and also Pamersi is part. We have fellows from the United Kingdom, the Netherlands, Croatia, United States, Ecuador, Belgium, Pakistan, totaling 87 fellows from 20 countries. We also have a solid network of fellows in Indonesia because it reflects our aim to be a leading institute in Indonesia itself and Southeast Asia as well. Next. So a brief information about our current research project, current and past. So as you may know from our title, it is a namesake that we have taken from one of our active research projects that we have right now, the SEARCH project, the Southeast Asia Resilience Hub, South Socioeconomic Coastal Resilience. So this research is part of a GCRF networking grant, which we were awarded in 2019 up until 2020. So the aim is to consolidate research and knowledge exchange, and more about extending or creating and extending a solid network of disaster practitioners, academics, who focuses mainly on resilience issues, from a multidisciplinary background in Southeast Asia. So it is a collaboration with the UK, with Coventry University. Next is the urban hydrometeorological disaster risk reduction with nature-based solutions. So our nature-based solutions knowledge group is actually growing. So this is part of I think 3 research projects that we have, which delves deeper into nature-based solutions. As an emerging discipline, the aim of this research is to identify best practices, map out current conditions and how nature-based solutions are implemented, support cooperation and enhance research capacity in the region, firstly in Indonesia and also in Southeast Asia. Lastly is to develop local knowledge-based strategies and recommendations. Next. Okay, so this our current research that we have right now which is also ongoing, is the Views from the Frontline survey, or the VFL survey 2019. So this is actually a research, more of like an implementation supported by the Global Network of Civil Society Organization for Disaster Reduction, or GNDR, a network of civil society organizations, a global network of which RDI is part, and also CDP is part of GNDR. So the aim of the survey, or the aim of the implementation, is to conduct a survey and utilize the findings of that survey related to disaster hazard and community disaster preparedness to build community-based resilience. So it is very much in line with the theme that we are currently in today of this webinar. Okay, next. Also, our past research, we have the seismic cities research that we conducted with Coventry University. So this search research is actually it's partly due to the ongoing collaboration that we had with Coventry University, where in the past research we also explored disaster preparedness in communities in urban and rural areas, which the focus specifically on earthquake-prone and seismically active areas. Okay, next, please. Right, so these are the sources of our research funding. So these encapsulate all of our research clusters, not only our disaster and climate resilience cluster. So, for instance, our Horizon 2020 is for our renewable energy projects, the Sasakawa Peace Foundations for our urban refugee projects. Future Cities Lab is part of our regional and urban planning cluster. Next. And these are the partners we work with, partner institutions that we work with in carrying out the research that we do. We highly believe in collaboration. We highly believe in creating new networks, as we do today. And I think our network of partners reflects that pretty well. Next. That's it for me. Thank you. I hope the picture that I drew is actually quite comprehensive, although in a short time. So please, back to you, Wiani. Thank you for the opportunity.
Thank you, Jitan, for a great brief sharing of RDI resources. If some of the research and publications we share are of your interest, please access the publications in RDI website, or just simply contact RDI. At this point, I will leave the floor to Pak Mercy Rampengan to listen his talk on the CBDRM and inclusiveness in Indonesia. Pak Mercy, the floor is yours.
Okay, thank you for the great opportunity. Good afternoon, everyone. Thank you, RDI, for this opportunity given to me to talk about disaster management and inclusiveness in Indonesia. I hope we will find several key points to consider in doing such a program in a community, because there are several lessons learned that I want to share, and also hope to have feedback from others. Next slide. Okay, this presentation is divided into two big sections. The first, I will talk about several key points to consider in doing community-based disaster management based on my previous and current activities. And also the second one, is about our program, RDI program being held in Bandung, related to the community-based disaster preparedness. If we see from this slide, we will find that there are several proliferation of community-based disaster risk management. We can see community-based disaster risk management, community-based disaster preparedness, integrated community-based risk reduction. So there are several forms of community-based in disaster management. It means one manifestation of the importance of local capacities in dealing with hazards. So in this case, the community become a core, a basis, and the backbones of the activities. This is, we have to put in our mind that, again, the community is the core, the basis, and the backbone of the program. Next. I would like to remind us again that the community themselves, they are the first responder of the disaster. They are the victims of disaster, and the recovery, the initial recovery, the preparation, and the response of disaster will depend on their capacity, not depend on their vulnerability status. So again, their life and livelihood will depend on their capacity, not their vulnerability status. If we look at the one survey after the Great Hanshin earthquake 1995 in Japan, they do such a survey. They found out that 95% chance to survive in golden period for the locals will depend on their self, family, and neighbors. It counted 95%. It means outside 95% actually have a less possibility to help them during the golden period after a disaster hit them. If we know exactly that their survival rate depends on their self, depend on their family response, depend on their neighbors' response, we have to consider that they are the main part of the program when we do community-based disaster management. So again, identifying the inherent capacity they have exists in the community is a critical point to putting in the in risk management strategies, because I found out that in many, when we come to the community doing a community-based program, we already set up our purposes. We already set up our objectives based on what we think about them, not what they think about themselves. This is problems, because I found out many differences, significant differences result when we actually not really immerse in the community to understand what actually problems they face on the ground. We sometimes already make a justification in advance before we know exactly what happened in the community. Next slide. So this is several points that I actually I can say that really important in considering doing community-based disaster management. First, about capacity and vulnerability. We have to focus on their capacity, not the vulnerability. Why? Because again, I said again, their life and livelihood depend on their capacity, not because of their weak. They exist there. They can survive. They can recover. They can make a good progress. It depends on their capacity, not their vulnerability. If we focus on their vulnerability points, when we going to the community, it will change actually the answer, the feedback the community will give to us. Then if we focus on the capacity. This is about part of the awareness, part of the how I can say about their confidence, appreciation that we can give to them. So we will find the right answer, the right solution, the right information from the community. We focus on strengthen them, not weaken them. Why I mentioned about to strengthen, not to weaken? Because in many cases, the intervention that we did in the community not really strengthen them, but actually we make them more depend on outsider support. They are the beneficiaries that really depend on our support. But I found out during my about 10 years activities as a volunteers in doing a community-based and as also as a researcher, the community will answer or will respond something based on our attitude, based on our approach. So this is not about the tools that we will apply in the community, but this is about our approach to the community. We can use the same tools, but we will find out that the answer or the response will be different. I did what to say, ICBRR program in one location. Before that one, before the program I did different things, not using the same tools, but different. I mean, based on the guidelines, we have to use 16 tools, but I just use 5 or 6 tools, but I use different approaches, and I found out that the response and the answer from the community totally different. The same community, the same place, with different 1-2 weeks time frame, they respond differently. So in this case, again, understanding their need, not their want, will be determine our program on the ground. Next. This is about the preparedness program, but sometimes we forget that preparedness cannot be formed or cannot be applied without awareness before. To be aware, people should have information, should have experience, knowledge, education about what actually they face on the ground or they face in their community, about maybe risk, hazard, about warning, about roles, about mitigation, about their local capacity, because sometimes they forget they have capacity to do that. They only think about how to relay everything to the support from outside. They forget about their capacity. And this is, again, like I said before in the slide previously, this is about our approach to the community. Our approach to the community will determine actually the answer and the response from the community. So the highlights, next slide, I can say that approaching the community in a positive light and recognizing their assets enable them to speak of their strength. This is something that really important to consider. We have to approach community. We see their capacity. We see about their past experience about how they deal with disaster. We have to appreciate that one. We have to find out what they have, what kind of access they have. If we want to use, if we want to do intervention, my suggestion, we have to start from the capacity, how they deal with the past hazards. And now, what the threats actually to the capacity that they have before. And the threats that they face today, that's a kind of intervention that we have to do to eliminate the threats. So maybe the program of community-based disaster management not really focus on the disaster itself, but will be different. Maybe we think before we will focus on how to build dike, how to build good buildings, how to build particular infrastructure. But if we focus on the threats facing by them, the threats that lowering their capacity, maybe the program will be focused not on the disaster things, but will be focused on their economic things, about social capitals, about several things that will be different with our prediction or our assumptions before. And the second, the complex reality of hazardous environments actually can facilitate the emergence of strengths and innovations. Again, the problems surrounding in their environment actually facilitate the innovation, the strengths they have, and we have to identify that one. We have to find out what kind of strength that actually occur because of the limitation of their environment. And if we only focus on the constraints they face, it will make us fail to identify the strength factors that will present an incomplete picture of situation and the solution which may be posed. If we already focus on their weaknesses, they will actually say about what kind of support you will deliver, not what kind of things that we can do to make us stronger than before.
Pak Mercy, yes, we have 4 minutes remaining.
Okay. Next, we will move to the CBDP implementation in Bandung City. What I want to say in here, I don't want to explain in detail, but at least just want to say that Bandung City prone to earthquake, landslide, floods, and RDI did several programs, CBDP programs in that area, and found out that their recommendation, the RDI recommendation actually not really fit with what the locals wants. This is interesting. Again, interesting because we already think that they need this one, that one, lots of things. But the locals have different preferences. And based on my previous slides before, it is clear that we need to examine about our approaches. We need to examine about our perspectives in seeing the locals as not as victims, but actually as the how to say it, as actors that can do lots of things because they know exactly their area, they know exactly the past history of their area, and our duty actually to deliver new information, new knowledge to them, to in combination. So between combination our knowledge and their experiences, we have to make a combination, and we actually have to immerse to understand about what they want, not what they need. So the last point that I can say in here, the last slide, I cited this one from one article. Outside perceptions can be very misleading. An outsider may see what is common in a given place, but that may be not the most important thing to the people concerned. Thank you.
Thank you, Pak Mercy, for your insightful findings from case study of CDP implementation in Bandung. I believe that 20 minutes might not sufficient to share all the lessons. So for participants who are joining, you might later access the all the presentations in RDI website.
Okay,
I'm
thank you.
very interested to how CBDP focus to improve capacity despite the vulnerabilities, Pak. But we will hold a bit the discussion after we listen to Lauren and Bu Lily. For the audience who is joining, please write down your question in the Padlet link we provide in the chat box. It will help us to highlight specific subtopics for further discussion. Our next presenter is Lauren B. De la Cruz. We will listening to her experience on CBDRM in a current context, some lesson learned from Philippines. Transfer to you, Lauren. I think you are on mute, Lauren.
Okay.
Yeah.
Okay. A blessed afternoon, everyone. This webinar is timely and fitting as we are facing either dual or multiple hazards in the context of the pandemic. We all want to change the world, right? Even amidst uncertainties and complexities. We therefore share a common vision for our country, sub-region, and the region, a safe and disaster-resilient nation and region with an enabling environment that uphold the rights of people and communities to development. Next slide. May I share with you very briefly the content of my presentation. I'll make it brief, but it covers 5 sections. Brief on CDP, the context where we are in my country, and then we zero into the ICBDRRM in context, the first responders, and the lessons learned. Next slide. For more than 2 decades, CDP has journeyed with affected people and communities in the pursuit of safe, resilient, and sustainable communities in the country and globally. As a pioneer in CBDRM, CDP has been the prime mover in community-based disaster risk reduction and management way back before the international frameworks have been agreed upon, such as the Yokohama Strategy, the Yoga Framework for Action, and now the Sendai Framework for Disaster Risk Reduction. Back then, it started to be called the Community-Based Disaster Management, or CBDM. Later, to appreciate the understanding of risk in disaster management, it was called CBDRM, or Community-Based Disaster Risk Management. And now the more popular CBDRRM that puts risk reduction along disaster management. That's why it's now called Community-Based Disaster Risk Reduction and Management. CDP CBDRM investment puts premium on the resilience, empowerment, and development of communities as primary responders in the midst of risks and vulnerabilities they face every day in times of disasters, and also when brought about by human-induced hazards such as armed conflict or aggressive development. CDP anchors its mandate on the affected people and communities that it definitely tries to serve with paramount significance. It promotes the all of society inclusive approach to capacity development and resilience building, prioritizing at-risk population which include women, children and young people, persons with disabilities, older persons, indigenous peoples, including LGBTQI. As a staunch advocate of policy development, CDP has been instrumental in the passage of the current law on DRRM, the RA 10121, thus provided significant inputs into the bill that was passed into law, into the development of the national framework and national plan. This is the very reason why it is sitting in the policy-making body as enshrined by the law. Continues to pursue policy development in line with the law up to the local level. As always, its valuing is in providing and creating platforms and avenues to listen and amplify the voices of communities and the marginalized sections of the population at various levels. CDP has developed particular projects for communities in major islands of the country, building partnerships with at-risk population as the organization capacitates them to build their capability to be represented and capable to collaborate in planning with local government units and organizing them to be represented in local policy-making and decision-making bodies in the localities. Next slide. The Philippines, the Philippines is one, no, back to the previous slide. Yeah, the Philippines is one of the populous countries in the world. It ranks 13 globally, third in Asia, and second in Southeast Asia. It is also one of the disaster-prone countries in the world, based on its location in the Pacific Ring of Fire and Western Pacific Basin. And this repeatedly struck by hydrometeorological hazards like earthquakes, typhoons and floods, and of course, including fires, landslides, drought, and volcanic eruptions. Name it, we all have it. The country also experiences human-induced hazards, as shown in the picture, and disasters caused by political and socio-economic origins, including armed conflict, like the Marawi siege in Mindanao, that threatened the security of civilian communities, resulting in displacement of thousands of civilians. And now, the whole world was shocked by the COVID-19 pandemic. It has impacted more than 200 countries in different regions of the globe. The Philippines is now first before it is second to Indonesia with the biggest number of cases of COVID-19 in Southeast Asia. Having COVID-19 coupled with the fact that it's rainy months in the country and we have started experiencing tropical storms and likely typhoons and also earthquakes that is now regularly happening in different parts of the country. And so the country is facing dual challenges or multiple hazards all at the same time amidst pandemic. Next slide. In any humanitarian emergencies or response, the first responders and community frontliners play a critical role in helping and assisting community members in saving lives. Their role is critical in the first 48 up to 72 hours, as other key players from the municipal level can only come at the minimum after 72 hours. Family preparedness is crucial as family members serve as first responders together with their neighbors and more often with the barangay officials. Our starting point is that it is best to rely on community members and initial resources that they have. This is important to harness and utilize first what is already there or available in the community. Putting the affected people and communities at the heart of action is ensuring their participation, feedback, and complaint mechanism integrated in all strategies, plans, and programs right from the very beginning of an emergency, informing them of issues and concerns that affect them so they are able to make informed decisions and choices. Now, next slide, the lessons learned. It is therefore important that programs and projects engage both at-risk population and communities, including duty bearers, to prevent, reduce, and manage disaster risks, including measures to adapt to climate change. It is equally important to have risk-informed planning and programming. Next slide. The best prevention and the way to slow down transmission is to have an informed citizenry that know the virus causes and how it spreads. Self-protection and also protecting others from infection can be done by washing the hands frequently and not touching the face, which can make a lot of difference. The practice of respiratory etiquette is also important, including the use of face masks and face shield to help prevent the spread, especially when we are in public places. Individuals and family members in the communities help in information dissemination and contribute to contact tracing based on their social circles and sphere of influence in their communities. And as they take care of their very own families, they are contributing not to increase the number of cases, which in our case is currently on the rise. Addressing the economic needs of the affected people and communities due to joblessness and job displacement is responding to the critical concerns of the pandemic, which are both health and economy and very much interrelated. A truly remarkable and source of inspiration are the women taking on the bridging role and leadership, starting with providing additional income support for their family and helping in health issues of the community. When the situation calls for it, it becomes natural for women to step up and exercise leadership for their family and community. A sustainable and institutionalized CBDRRM is the foundation of an all of society and whole of nation approach. These are the reasons for the pursuit of a sustainable and institutionalized CBDRRM. Next slide. Aside from preventive approach, CDP also responds in the context of COVID in mental health psychosocial support services, identified as one of the most urgent need and concern not only by health workers and frontliners, but by the affected population as well. CDP has designed an online approach to conduct MHPSS among health workers and frontliners to cope and manage in COVID response. They experience stress, pressure, and uncertainty amidst COVID situation. CDP's MHPSS became a welcome intervention by the people affected and suffering from distress. CDP does the MHPSS in a non-threatening, lighter process and approach for about 2 hours, either face-to-face but observing physical distancing or via online. In the course of the intervention, the participants get to identify what they want to do to be helpful to the affected people and communities. They call resilient statements and frame shared articulated statements into resilient attributes that provides hope and resilience for the participants. An example of a statement from the participants would be like, It's my responsibility to be strong. The resilient attribute that may be called from such a statement is mission in life, wherein the participant is able to see his or her self-assigned purpose that creates a sense of meaning. From CDP psychosocial support services interventions that were already conducted, the feedback was that the intervention has been very helpful for them to proceed with their job assignment in a more positive and hopeful perspective. They were able to harness the strength from one another and the courage to proceed despite fear and uncertainties. It is high time to mainstream mental health and psychosocial support services in our programming of humanitarian preparedness and response, as it is the real and urgent concern both for responders and frontliners and also for the affected population. Next slide. Because times are changing, the requirements to succeed in the work that we do is to deliver our work with high quality. As CDP programs naturally and normally interface, varying levels of integrated thinking and action can manifest and become evident in the following. One, coherence is the shared depth of understanding about the purpose and nature of the work in the minds and actions per individual and most especially at the collective level. It is regularly talking the work that we collectively do. Integration is a discipline of deliberately connecting the organization's strategy, governance, performance, and prospects towards unleashing benefits for the organization. It is not just about integrating plans and policies across disciplines and organizations involved for the benefit of the communities. Convergence can be in the form of aligning resources, planning, and activities that may be separate but complementary. It could be coordinated planning of actions conducted separately by local actors, but linked and complementary, which have coordinated reporting and monitoring. Consolidation. Efforts in this area can reinforce cooperation and mechanism which may favor stability, synergy of actions, open and permanent dialogues. Both dialogues and information sharing reinforce social cohesion between and among main actors to the extent of shared decision making. Linking horizontal and vertical connecting for consistency and harmony. This helps to identify conflicts and inconsistencies and leverage opportunities for planning or per project for resource maximization and to avoid duplication. Unifying the art of drawing together partners and stakeholders for joint action, utilizing partnerships to work together resulting in shared action, shared resources, shared advocacy, and shared voice. Internal to the organization, this can bring about new knowledge, new learnings, innovation, new skills, and new approaches. Integrated thinking and action may be embedded in mainstream programming and practice of CBDRRM. Can result in efficiency and productivity and contribute to the organization's stability and sustainability. Okay, next slide. What are the required skills for integrated thinking and action? Let's start with communication and collaboration. It is the interpersonal skills that will help us to work well with one another. We need to build a shared understanding. We need to negotiate outcomes and cultivate trust to work together to solve problems that no one can solve alone. We also need to embrace diversity. To active citizenship, it is having a concern for our community, for our society, being engaged in our community on the key issues and concerns that matter most to them. Critical thinking and problem solving. Problem solving is focused on a specific situation. Always remember that our values and goals serve as our compass in having a critical mind and in solving problems. Next slide, the last three. Creativity and imagination. Creativity is the ability to create something using imagination. Imagination is saying the impossible. Creativity is using imagination to unleash the potential of existing ideas to create new and valuable ones. Digital literacy, this is the current need right now. It is the ability to use information and communication technologies to find, evaluate, create, and communicate information, requiring both cognitive and technical skills. Last, leadership and development. The usual reality is that learning leaders are often so focused on developing programs and plans for learners that they skip factoring the most important development, their own personal development. Looking inward helps us to maximize our strengths, reach our potential as a leader in order to better impact our team. Next slide. Local leadership is important towards the pursuit of sustainable development. Local communities most at risk can be enabled to participate, influence, and take decisions on agenda matters that affect them. Civil society organizations can lead in championing the localization agenda in collaboration with government and other stakeholders in preparedness and response and in development actions. An enabling environment exists for CSOs to lead such agenda in resilience decision-making processes. The localization needs a movement that connects communities in different localities and countries to amplify their voices at relevant national and international levels. CSOs as champions of localization can be accountable to communities and also accountable to localization. A tripartite partnership is a good example, like the Philippine Preparedness Partnership, where government, CSO, and private sector takes the lead in humanitarian preparedness and response. Transformative change needs to happen so that local communities will have the space and influence and access to resources and the power to take decisions. The transfer of financial resources as directly as possible to local actors is a critical measurement of localization to ensure the matching of words and actions. Next slide. CDP doesn't want to lose sight of the pillars where it wanted to contribute its share in reducing, if not totally eradicating poverty in the country, in shifting the power through influencing from the powers that be to the people whose voice needs to be amplified. Like any and many growth processes, individuals, families, and communities need to grow in a society where spaces are provided for hard decisions so that even differences can be celebrated for the good of the whole and for higher purposes. We will overcome adjustments and difficulties in this new way of integrated thinking and action. We will achieve integrated thinking and action for resilience, empowerment, and development for individuals, for families, for community, and the whole of society. Let me close this by going back to what we have started, what I've shared earlier. We all want to change this world. Therefore, we will promote the rights of the affected people for a safe, resilient, and sustainable future. As such, let me quote Roosevelt's wise words. Do what you can with what you have where you are. Focus on the present and do your best. Thank you and mabuhay.
Thank you, Lauren. Right on time. You brought us I think you brought us a very valuable synthetic, which I believe gaining from years of ground experience in disaster management in Philippines. You were highlighting the importance to rely to community and family members as the frontliner and first responder, as well as the need to particular focus to mental health and psychosocial support. Before we listen to our next panelist, I would like to again remind our participants to drop your questions in a Padlet to be later sorted out by the team. Our third presenter is Ibu Krisan Lili Kusumawardoyo from ASB. She will navigate us through her research finding from post-earthquake was intervention in Central Sulawesi. The floor is yours, Bu Lili.
Thank you, Ibu Yani. Good afternoon, everyone. Today I'm going to be sharing a reflection from our study that's currently still in progress, titled Investing in Inclusive WASH, Identifying Barriers and Values. This research project is supported by ELRA's Humanitarian Innovation Fund, funded by UKAID. ELRA is a global charity that's focusing on solving complex humanitarian problems through research and innovation. This research is implemented in partnership by ASB Indonesia and the Philippines, the Center for Health Policy and Management, which is a research institution under Gajah Mada University, and Pokja of Pasigala, or the Working Group of Organizations of Persons with Disabilities in Central Sulawesi. The OPD's working group is actively involved throughout this research as our peer researcher, reflecting our belief that meaningful participation of persons with disabilities is key for inclusive services. Next slide, please. Okay, so this study is implemented in 2 districts and a city in Central Sulawesi, Indonesia, areas that are affected by tsunami, earthquake, and liquefaction in late 2018. The aim of our study is to explore the barriers and opportunities for inclusion of persons with disabilities and older people in humanitarian response, particularly in water supply, sanitation, and hygiene or WASH services. Next slide, please. In our journey towards inclusive WASH, we have seen many standards and guidance for inclusion of persons with disabilities and older people in humanitarian response. For instance, there's the humanitarian inclusion standards for older people and people with disabilities, which is a SPEAR companion standard. And there's also the ISC guideline, IFRC guideline, and specific to WASH sector, there's the UNICEF guidance on inclusion for children with disabilities in WASH. And the World Bank also has the guide for inclusion in water operation. And there's so many other guidelines out there. So I think in terms of standards and guidance, I think it's safe to say that we have already plenty to guide our action. Yet, even with those guidance, it seems that our progress for inclusion in WASH humanitarian response is still very slow. So the question is why? Why aren't we there yet? What are the barriers that are blocking our way into achieving the ultimate destination of having humanitarian services that are inclusive for older people and persons with disabilities? What are the opportunities that we can take together to speed up our journey? So these are the questions that we are set to answer through this research project. We hope that by answering these questions, this research can contribute in building the understanding on the barriers to inclusion so that more effective and inclusive WASH programs can be developed. Next slide, please. To find answers to these questions, we turn to 2 sets of informants. The first is the WASH actors taking part in Central Sulawesi humanitarian response as the service providers. And second, persons with disabilities and older people as the user of the services provided by the WASH actors. As I mentioned earlier, we are doing this whole process together with Pokja Obdis Pasigala, the OPD, as our co-researcher. This is the way for us to ensure that the research process is inclusive for persons with disabilities, not only as target informants, but also as active contributor in this research, because we believe that's the ethical thing to do. They have gone through the training to enable them to conduct research, and most of all, I think what we hope to get from their involvement is really that for them to understand about what's inclusive, what does it look like, and hopefully later on be actively advocating for it. This research project is still ongoing, but so far we have completed our main blocks for data collection. We have conducted interviews with 58 persons with disabilities and older people in 9 villages, affected areas in Central Sulawesi. And we have also completed a round of survey participated by 26 agencies that provide WAS services as part of their humanitarian response in Central Sulawesi. Out of the 26 respondents of our survey, we interviewed select WAS as actors from varied organizations representing local NGOs, international NGOs, donors, and government actors. We still plan to triangulate our findings through another set of data collection involving FGDs with WAS actors and also FGDs with persons with disabilities and older people, and then later on conduct a validation workshop. Next slide, please. Next. Okay, so although this research is still in progress, we have done some preliminary analysis and found some interesting emerging findings on barriers for achieving inclusive WASH. First, let's have a look at the barriers from the WAS actor side. Next slide, please. From both our survey and interview with WAS actors, we found that WAS actors do not see persons with disabilities and older people as potential contributors in WAS response. We know that in general, persons with disabilities and older people are often seen as objects of charity. In humanitarian response, they are considered as the vulnerable population, the target of rescue or relief by humanitarian actors. Within this perception, it seems that the capacity of persons with disabilities and older people to contribute is neglected. As a result, we found that WAS actors conduct activities for persons with disabilities and older people or about persons with disabilities and older people, but not with persons with disabilities and older people. For instance, 50 to 70% of our WAS respondents reported that they collected some data and conducted risk analysis about persons with disabilities and older people. However, 70% of our respondents said that they're not partnering with Older People Association or OPA or organizations of persons with disabilities or OPDs. And they confirmed that throughout the project cycle, OPAs and OPDs are not involved, starting from the planning of the project, the implementation, and also during the monitoring and evaluation of WAS projects. Only 23% of our respondents said that they ensure involvement of persons with disabilities and older people in WAS committees in their communities. Finally, it appears that the main priorities for WAS actors is about making WAS facilities available in as much as possible and also in shortest possible time. And as a result, inclusion is only considered as an additional feature to that. So it's good to have, but not a must. There are some donors who are encouraging inclusive response and thus requiring projects to ensure accessibility of the WAS facilities that they're building. Yet, in practice, we found that this only become a kind of like ticking the box exercise, since persons with disabilities and older people are not consulted in the planning, implementation, and also monitoring of the facilities. According to the WAS actors, their constraint in prioritizing persons with disabilities and older people is because they see this group as small compared to the general population. They also feel that there seems to be no demand for inclusion in their WAS services coming from the persons with disabilities and older people. So we try to fit this puzzle with the barriers that's faced by persons with disabilities and older people. Is it true that they're not demanding for inclusive WAS services? And if so, what are the barriers from their side? Next slide, please. What we found from our informants from persons with disabilities and older people category is that they do not belong to older people associations or OPAs and organization of persons with disabilities or OPDs. Such peer focus group do not exist in the village, and therefore there are some consequences. For instance, we know that these groups are important institutions in helping one becoming aware about their rights and also provide peer support to demand those rights fulfillment collectively. So without involvement in these groups, persons with disabilities and older people do not have the support that they need in order to demand the services be provided in ways that best meet their needs. Another barriers for persons with disabilities and older people in demanding inclusive WASH services is due to the fact that throughout their lives, they have been very good at adapting and also accommodating all the different barriers that they face. And they do this as their usual means of survival. Prior to the disaster, they do not use accessible toilets because it's just simply not available for them. Out of the older people informant who have toilets, and yes, there are some older people respondents who said that they don't have toilets. Out of those who have toilets, they said that everyone is using the squatting toilet, although it's of course difficult to balance, especially for those with knee arthritis condition. They also somehow managed to collect other points that located far, far away from their homes. So they're so used to adapting to all these challenges that when disaster happens, of course, they do not expect that things should suddenly become accessible for them, let alone demanding for it. Most do not even know that inclusive services are possible. In our interview, for instance, we use pictures as one of our ways to engage with the informants. When we show them the picture of accessible toilets or accessible water points, no one seemed to have seen this kind of facilities or this kind of accessibility services before. So the question is, how can we expect them to demand something that they cannot imagine exists? Further, when we ask them if they have feedback in regards to the WASH services that they received during the response, persons with disabilities and older people often mention that, no, we don't have anything to say. They would say, at least there are relief items being delivered to us, right? It's better than nothing, and we are grateful for it already. So they have learned that the way to cope with the situation is not by demanding the services to be available, to be accessible, to be inclusive for them, but by adapting through other means. And finally, we find persons with disabilities and older people do not see that they are expected and will be supported to contribute. When asked whether they would like to be involved, most informants from persons with disabilities and older people category responded that they do not want to be involved because it will be difficult for them to go to the village meeting hall. This is the same reason that was mentioned by our WASH informants, that no, it will be too tiring for the older people to attend meetings or for persons with disabilities to travel from their home to the village meeting hall and so on. So many, many reasons. Yet, when we ask persons with disabilities and older people whether they would like to be consulted through means that are reasonably accommodating their needs, they said yes. But unfortunately, they do not see such opportunity to be supported. Mm-hmm. Next slide, please. Despite all the barriers faced by both sides, the good news is we also found some signs of opportunities. There are some good practices exist, albeit still very limited, that we can focus on in order to improve the inclusion outcomes. Our research confirms that there is already a strong awareness of inclusion standards and guidance, and these are considered relevant by WAS actors. More than half of our WAS respondents said that they study these guidelines before the actual response and also use them again in evaluating their project. We see this as a potential opportunity because these standards and guidelines can then help the WAS practitioners to plan a more inclusive response. Can you click again? Yes, thank you. There seems to be some level of awareness also about assessing the needs and impact of disaster experience by persons with disabilities and older people during the rapid assessment. There are 40 to 50% of our WAS respondents who mentioned that the rapid assessment tool already include questions on needs of persons with disabilities and older people. So this can be opportunity to understanding the disproportionate disaster impact faced by persons with disabilities and older people, and also understanding the needs that they may have. Although, like I mentioned earlier, it will be good if this is equipped further with capacity analysis. Another good practice that we found is there are 66% of us respondents who claim that they have some budget allocation to ensure inclusion in their project. Some organizations also start to invest more in training their staffs and their stakeholders in terms of disability inclusion, and such initiatives are facilitated by persons with disabilities themselves directly. So that's good. We think that these practices are certainly beneficial for improving inclusion outcomes and therefore should be maximized further. On the other hand, we also found that persons with disabilities and older people in the community are actually very much willing to be involved as contributive actors in WAS response. We believe that given the support and opportunity, they can meaningfully contribute to improve inclusion in WAS response. And all this can be opportunities for us to speed up our journey towards inclusive WAS. And I will end my presentation at that. Back to you, Bu Yani. Thank you so much.
Thank you so much, Bu Lily, for your interesting presentation. Water sanitation and hygiene is one of the immediate need in post-disaster. The early research finding provide us valuable lessons on how people perceive vulnerability. That was very interesting, Bu Lily, in particular to people with disabilities and elderly. And the good news is, fortunately, a good opportunity is around to be more inclusive as the awareness is continued to build, and some have managed to apply an inclusive approach throughout a project cycle. We have listened to all our panelists today, and we are now getting into discussion session. We received some questions from the audience. I will read some. I think I will begin with questions addressed to all of our panelists. The first question is it true that economic capacity is the main trait of resilience? How does COVID-19 now affect the vulnerable groups when they are exposed to natural hazards that regularly hit them? Do they get worse? In what way, and how interventions are going to be taken? That's the first question addressed to all of our panelists. The next questions, as I understand, is to what extent does the community can help? What limits do they have? Is there any challenge? These questions addressed to Dr. Mercy, but I need to check if he still can respond to these questions. Pak Mercy is on his way to the airport, I believe. So I think we will begin with the first questions. I still have some remaining questions, but I will stop with those two first questions first. You will take the first turn, Lauren, please.
Uh, can you repeat the question?
Is it true that economic capacity is the main trait of resilience? How does COVID-19 now affect the vulnerable groups when they are exposed to the natural hazard that regularly hit them? So this could be parallel crisis at the same time.
Mhm.
Do they get worse? In what way? And how interventions are being taken from your experience?
Of course, I think Dr. Mercy has mentioned like when we do CBDRM in the communities, we look at the risk and vulnerabilities that they are experiencing, but at the same time, we also assess and highlight their capacities. Um, and so, how do we manage the risk and vulnerabilities of the community? As I've said earlier, what's important is to have informed citizenry. Like in the case of hazards, they should know how really to prevent, how to prepare, and how to really manage when it happens in their midst. In the context of the COVID, they really need to understand and really do their part, their role in terms of self-protection, protecting their families and even their communities by contributing to information dissemination. Like as I've shared, they are already doing their part if they do the preventive measures like washing hands frequently, uh, observing physical distancing, using face masks and face shields, and as best as possible, if there's no need, they don't go out in public, especially for older persons with disabilities, and with children and young people as well. In the context of the Philippines, we have defined age from 20 and below. They shouldn't be going out if there's no real need to go out. So, on the question of economic, yes, it's really a major concern, the economic part, because of the pandemic. So many and when the government declared, we call it enhanced community quarantine, but actually it's a euphemism for lockdown. So for close to 3 months, people cannot really go out and go to work. So it really affected the economy of many families and communities, especially those on the lower middle and even small enterprises. So, and now that we're starting to hopefully recover, but still, it's not yet in the normal or regular operation. Only 30% of operation of organizations, companies, and even government are back to normal. So it's not really normal yet. Actually, it's the new normal. So, of course, our government has approved a budget for recovery already, hopefully assisting the economically displaced, like drivers, vendors, small enterprises. Hopefully, slowly, they can really cope and manage with the situation, especially that there's no clear sight yet of how we can really, overcome this pandemic. So, but the good thing with Filipinos is that we're a resilient population. So we're trying our best to really cope and manage amidst our situation. That's why I'm I've also shared that the psychosocial support services is also needed, especially for the frontliners, particularly the medical professionals and health workers, as they are really the ones doing a lot of work in the healthcare system. So, yeah.
Thank you, Bu Lauren. And we have three questions directed to Ibu Lily. I will read each of the questions. The first questions from environmental and institutional barriers faced by marginalized groups. Which barrier that pose a great challenge to achieve inclusive was? I think this is something correspond with your presentation on the barriers. Which one among those you think pose a great challenge to achieve the inclusive was? The second
Okay, thank you, Briani. That's a very
yeah,
oh,
I think
okay.
I will read all those three questions so you can respond at once.
Okay, cool.
How
Yes.
important the involvement of OPDs and OPAs? Is it better to involve as an organization or individually person with disabilities and older people?
Mhm.
The last questions directed to Bu Lily is how important the, oh, I think that's those two first. Please, Bu Lily, we are listening to you.
Okay, thank you, Briani. Those two are very important question and something that we've been really considering throughout this analysis of this research. First of all, about the institutional barriers or the environmental barriers, which are the most significant challenge. Um, I think it's difficult to say because one, we're not really measuring which challenge or barriers is bigger than the other. That's not our focus. But then what we found is that actually, if you focus on physical barriers that are posed by, the environmental inaccessibility, those are actually the easier part to tackle because it's more tangible. There's actually some studies conducted by WaterAid in 2012. WaterAid is an organization that's focusing on making WAS services inclusive also. And they found that, they mentioned that removing the physical barriers is the easy part because it's more tangible. And then maybe that's why there's so many guidelines and documents that are focusing on, how to improve the physical accessibility. But then they're saying that the institutional and attitudinal barriers, those are less tangible than the physical ones, than the environment barriers. And therefore, because it's less obvious, it's more difficult to change. So I think one, we're not quantifying which barrier is bigger than the other, but we know that we need to focus more on the behavioral issues, the institutional and also the attitudinal barriers, because then it's the less obvious and more difficult to challenge, to change. And the second question in regards to whether we need to partner with individuals, person with disability, or older people, as opposed to their organization, their representing organizations such as OPDs and OPAs. It's interesting because, like what we found in our survey to WAS actors, they said that 70% of them are not partnering with OPDs and OPAs in Central Sulawesi. But then when we cross-check with the 9 villages where we conducted the research, we also found out that actually there's no OPDs and OPAs in those locations. So that could also explain why there's no partnership between OPDs and the WAS actors at the village level. But then I think that's not the excuse, because at the higher level, not the village level, but at least in, like for instance, we're partnering with Pokja of this Pasigala, which is a working group that comprised of 5 OPDs. So OPDs are actually available, but OPAs or Older People Association, it is harder to find in the community. Some are embedded as the group of, it's part of the community health services focusing on older people already, but then it's very small. So I think it's true that if you want to partner with at the organization level, there are some challenges if they do not exist. But like what I mentioned in my presentation earlier, I think if we work with OPDs and OPAs, it's of course a lot more sustainable, it's more institutionalized compared to individual engagement. And also there are some benefits that I mentioned earlier, such as, if persons with disabilities and older people, if they work together with their peers under the OPAs and OPDs, they become more aware about their rights, and also they found the support that they need in order to demand for things to change, in order to advocate for their needs to be met. So I think considering those benefits, as much as possible, I would encourage to find contacts of OPDs and also OPAs and partner with them as opposed to individuals. Although this is not always possible, of course. I hope that answers the question. So back to you, Bu Yani.
Yeah. Thank you. I'll get back to Bu Leren, as I noticed that there are also few questions directed to Lauren before we get into some questions we receive addressed to Dr. Mercy. Lauren, there is a question on what are the lessons learned of CBDRM from Philippines that might be applicable in Indonesia and vice versa. I think both have similar characteristic in terms of geographical and cultural. So these questions might be interesting to hear from you. You are on mute, Lauren.
Okay. Yes, that's an interesting question. I think, yes, we're sharing very similar situation in terms of yes, you have a bigger population, but natural hazards, we're experiencing the same. And so the importance of CBDRM is really, cannot be underestimated. So from experience in the Philippines, it's really going through the process with the communities, really engaging them in participatory processes, because they know exactly what they face, what they are experiencing, the risks and vulnerabilities that they have. So from community risk assessments to the planning process, either for contingency planning for specific hazards, up to the more comprehensive disaster risk reduction and management planning, they have to be involved, and they have an important role to play. And it's really best to organize them, because after such process, they really need to have an opportunity to have a voice in the policy and decision-making bodies in the localities. So organizing, engaging them in advocacy for asserting their rights, for their participation in various bodies, and defining pathways for their choices and developments, and for decision making, they should be a part of it. So what's good, because of with this kind of a situation with pandemic, I saw the question also that it's really an extra challenge for humanitarian organizations to go on field. And so if communities are organized through different organizations of vulnerable sectors like women, children and young people, older persons, persons with disabilities. They can be the ones that serve as channel for any humanitarian response that can be undertaken in the localities, because right now some of the humanitarian response are undertaken remotely. So it's channeled either through the local government units or up to the barangays or through the organizations, civil society organizations or faith-based organizations working on the ground. So that's why CBDRM is really about, you know, organizing, capacitating people in the communities so they know their way, whatever happens every day during disasters and post disasters, and even with dual or multiple hazards, especially with what's happening right now.
Yeah,
Back to you, by Yumi.
thank you, Lauren. Yeah, I think the point from Lauren is interesting that in principle the participatory process is applicable for both countries, and we found that this is actually a share lessons that were applicable for the two countries, Indonesia and Philippines. I have also received some questions addressed to Dr. Mercy, but need to check. Are you there, Pak Mercy? Can you listen to me?
Yes, I think, can you hear my voice now?
Yes, Pak.
Sorry, because I'm checking in now at the moment, but it's okay, I think.
Okay. Okay. I'll read quickly the questions. The first
Yep.
questions. To what extent does the community can help? What limits do they have? Any challenge? Is there any challenge you can share with us? This
Okay, based on my experience, it is difficult to imagine actually the capacity the people have. I found that one small village in North Sulawesi, in small island, pretty small island, they can survive after the eruption that totally destroy their village, and then they can rebuild in 4 years without any support from the government. And there's already a paper about that one. I already published that one. So to what extent actually the community can build their or facing the disaster, it depends one point. One point is about social capital. In many places in Indonesia, it depends on social capital, not about the economic things, but social capital things. It relates later on to the capacity of them in rebuild their economics and other assets. So the starting point is about social capitals. Thank you.
Thank you, Pak. Do you still have any time for another question?
Oh yeah, what question?
Yeah, there is one more question. Can we consider COVID-19 and earthquake, for example, to constitute dual hazard? Is the pandemic considered a hazard? This is the questions addressed to you.
Yes, it is a part of hazard. And again, to cope with that hazard, we can see now, it depends on the community. Everything the government do will be failed. Otherwise, the community involved take part to support the government program. Again, I want to say that social capital play an important thing in facing the pandemic of COVID-19.
Yeah.
Yep.
Thank you, Pak.
Okay.
Have a safe travel.
Thank you.
Expect to
Sorry,
talk to
because
you
in
again
hurry.
someday in the future.
Yep.
Yeah, my apologies. I will going back and forth with our panelists because the questions are coming not in order. So I still have two questions addressed to Lauren. Interesting presentation from Mrs. Lauren about CBDR RM in the Philippines context. Does the community itself already has a prior local knowledge about disaster and disaster management? If there is, how do the government and other actors involved include and integrate the local knowledge into the RRM policy program, and how to preserve it? The questions is coming from Rufaida and addressed to Lauren. But Lauren, I have also secured another question. I interested to particularly to your presentation on digital literacy and how this link to what's so called integrate thinking and actions. I hope you can cover those two questions, please.
Okay. Yes. Of course, in the context of the Philippines, because we have passed the law in 2010, it's close to a decade already to this date. And actually, the government is thinking of replacing the current law. But of course, there are some reactions from different organizations in line with that, because the current law is really good in terms of really capitalizing on and really investing on the foundation of community-based disaster risk reduction and management. So that's the good thing. The law has actually stipulated it in the law that CBDRM should be the foundation of all the four pillars of disaster risk reduction and management, from preparedness to response to recovery, rehabilitation, and prevention and mitigation. And so with that, the government, of course, not all the barangays and the communities were covered in the last close to a decade already of the law of really capacitating the local communities. But we've made significant headway because there are also CSO, civil society organizations, investing in it, and even faith-based organizations. And so on the question of whether the communities know the hazards and can they do something about it, of course, now especially after Ketsana, after Hayan, we've learned our lessons. And so communities are really more ready, or should I say prepared, and also the local government units. So we are more prepared. But the thing is, right now, how do you manage dual hazards? Like in the context of the Philippines, we are in a pandemic. The cases are increasing, and now we have tropical storms or typhoons, and there are floods. So it becomes dual hazard. And just few days ago, we have also the earthquake in Masbate, with deaths and injuries and severe devastation. So how do you manage that? Yes, we're ready for specific or particular hazards, or hazards coming one after another, but dual or multiple hazards, it's really a new, an extra challenge for all of us, both on the side of the government and of course, the organized communities and civil society organizations. But we're we're learning in the course. We're learning in the process. Like, of course, you don't use evacuation center for pandemic for a natural hazard where you need to evacuate people in the communities. That should be totally separate. Unlike before that you can really, just convert the school, but now schools are also being converted as quarantines for pandemic. So that's the situation. In terms of digital literacy, I think this is the way forward now. Before, yes, we're using digital means for organizations in different parts of the world, for doing meetings, for having seminars through webinars, or learning events through webinars. But now it looks like it would be it would become a natural or normal kind of integration into our ways of working, because we can combine both going to the field, going to the organizations that we engage, because yes, we can go to the organizations, to the field, but we need to observe physical distancing, and therefore you can only gather maximum of 10 people, unlike before when you can gather 30 to 50 people. So that's the face-to-face kind of thing. And then complement that with the digital means using online platforms. So now we're becoming used to many Zoom meetings for official meetings, and some, learning events or advocacy, kind of agenda being tackled also in meetings. So, but digital means is really, for me, it's kind of, I I get some headaches if I'm in Zoom meetings for about 2 to 3 hours already. So it's more tiring because you cannot see the people, you cannot see their reactions. It's more challenging, but we need to adjust. This is part of our new ways of working. Back
Thank
to
you.
you, Buyani.
Thank you, Lauren. We have 8 minutes left. I still notice that we have two questions addressed to Bu Lily. So I will read the two questions so Bu Lily can respond at one go. To what extent the stakeholders in Indonesia have considered WOS facilities with universal designs to promote inclusive post-disaster situation for people with disabilities? This question is coming from Dityo from UN University. The second question is, what would you recommend as an appropriate approach for government toward an inclusive WOS? I believe that to some extent we consider that NGOs have control over less significant resources, but for the government, their scopes can be much more broader. What would be your recommendation in terms of policy and enabling conditions that the government should pay attention to? So please respond at what Bu Lily.
Okay, thank you, Bu Yani. Very, very interesting question. So, Pak Dityo, first, I would like to clarify that the scope of our study is not throughout Indonesia, it's just in Central Sulawesi. And your question is actually one of our questions in our survey. We asked the WAS respondents participating in our survey to mention to what extent that they consider universal design in the design of their WAS infrastructure. And interestingly, there were above 60% of the WAS actors said that they actually follow the universal design on the WAS infrastructure that they built in order to ensure accessibility. So it seems that there is this strong focus toward the ensuring accessibility in terms of the physical barriers, because as I said earlier, that's the most tangible part. And there's also one donor organization that we have interviewed that seems to be a very strong proponent for universal design, because if you design something, making sure that it's accessible not only for persons with disabilities, older people, pregnant women, and so on, then everybody can basically use that. And this donor is basically encouraging the projects that they fund in order to ensure accessibility in WAS infrastructure by meeting the universal design. But mind you, this is still research in progress that we're doing, and to what extent that this donor policy is being implemented on the ground, we still don't know, and we still need to triangulate that with other source of data collection, for instance, such as the direct observation in Central Sulawesi. So that we don't know, but what I can say for sure is that it seems like there's a very strong focus toward the ensuring tackling the physical barriers, ensuring accessibility. There seems to be stronger awareness towards that, but what seems to be lacking is the behavioral change, attitudinal change in terms of seeing persons with disabilities and older people as source of your basically your partners in delivering the WAS services. And that we can see from the WAS respondents said that only 30% of them, for example, conduct consultation with persons with disabilities and older people, and also they do not seem to have the feedback mechanism to collect feedback from persons with disabilities and older people who are using their services. So I think these are the areas that we're lacking behind and needs further focus. And the second question, in terms of the role of the government, certainly, I mean, we're NGO and we're here only for a short period of time maybe, and we have a lot of limitation in terms of our project areas that we can work on, our resources and so on. But government are here to stay, and this is their responsibilities also as the duty bearers. So I think what I can recommend is, of course, to strengthen their focus in terms of coordination and also supporting organization, including NGOs, in all activities, all initiatives that they do in order to improve inclusion. And of course, same recommendation that we will give to NGOs applies to the government also, that the direct experience of interacting with persons with disabilities and older people is a crucial element to our behavioral change. So this is something that we would encourage also, because that's really important, to directly partnership with persons with disabilities and older people's association. I think that would be my answer. Hopefully it's sufficient. Back to you, Briani.
Thank you. I think that's all the questions are coming, and I would like to thank you to all the participants for your questions, and we are about to wrap up the discussion. And we will request a closing statement from our panelists, but I will read some points I wrote. We can consider as a takeaway from today's webinar. My first point is awareness to preparedness is critical. To better prepare for disasters, and education is the key elements to understanding risk, roles, and capacity. Pak Mercy share ideas of making communities as the core. This is the spirit of what so-called CBDP ICBRR, and we are happy to see that the community are engaged in discussion of risk information and planning measures to reduce risk. What we need is to improve local coping and adaptation capacities and maintain multi-stakeholders collaborations. We notice also that there is already a stronger awareness and need assessment conducted prior to responding, which have considered the need and impact of disaster to different groups of people, but at the same time, challenge is remaining that there is a tendency that respondents consider vulnerability groups as an object for charity rather than a subject to contribute. The vulnerable groups have to be involved for sure in the decision making throughout the project cycle. This is one of takeaways I think we all firm. Lawrence has as a great framework, synthesizing CDP experience in community-based disaster risk management. And among the lessons learned is to mainstream mental health and psychosocial support in humanitarian programming and encourage for active participations in planned activities and policies, and the importance of bridging leading role of women and making the DRM localized. I believe I did not cover all the valuable lessons from sharing sessions today, but if you are interested to access the slides, you may go to RDA Knowledge Hubs on the website, and I think the team will share you the link to access all the resources we have shared today and some others from RDI resources. We are about to end the webinar, but I would like to take a few minutes to listen a closing statement from our today's panelists. In order from Pak Mercy, checking Pak, can you still listen to us or? Yeah, I think we don't have Pak Mercy around. He might be on a plane right now. So I'll pass the first turn to Lauren, 1 minute to 2 minutes closing statement, and then Bu Lily. Please, Lauren.
Oh, okay. Yes, thank you, Bu Yami. I think we can all agree that we are experiencing uncertainties, complexities and ambiguities in our situation right now. But I would like to hold on to the positive and more hopeful perspective that I think we can all overcome this and lead in a better new normal. So, yes, this is the situation we are in right now. But as Roosevelt has said, let's focus on this and let's do our best. And we can surmount everything. Thank you.
Thank you. What a great closing, Bu. Bu Lily, pass over to you for a closing statement.
Thank you. I think as NGOs, we are so used to the concept of participation and why it is important. That's why we do activities not only for our communities, but also with our communities. But I think it's worth reflecting whether we are extending that level of participation toward the vulnerable groups. It seems that the concept of vulnerability makes us focus solely on needs and not the capacity. And as a result, this is becoming a blind spot for us in ensuring participation of community members who are often categorized within this group, like persons with disabilities and older people. As the famous saying in disability community, nothing about us without us. We can only be truly inclusive and ensure the relevance of our work if we work directly with persons with disabilities and older people. So I guess this is a challenge for all of us to recognize that potential blind spot and make adjustment accordingly.
Yeah.
Thank you, Brianne.
Very lovely closing, Bu. Oh, nothing about us without us. I think that's the spirit of being inclusive. And it was very enjoyable and hope to be insightful as well to all our participants. I would like to thank you to all of the panelists today. On behalf of the organizers, I would like to thank you all the participants for joining us today. There will be another series of webinar in the future that we expect you to also join. Good afternoon, and let us working together to improve inclusion in disaster response. Good afternoon, and have a productive days ahead. See you all. Bye.
Bye. Thank you.